Regarding community-acquired atypical pneumonia, the most common causative organism is Mycoplasma pneumoniae. Other organisms include viruses such as influenza virus type A or B, respiratory syncytial virus, or adenovirus. Other organisms include chlamydia species and Coxella bornetiae. This type or syndrome of pneumonia is called atypical because it produces moderate amount of sputum, lack of consolidation, moderate elevation of white BC. يعني الوايت BC ما ترتفع كلش هواي مثل community acquired acute pneumonia. And the most important characteristic feature is a lack of alveolar exudates. يعني ما يصير inflammatory cell exudate inside the alveoli، يصير بالinterstitium اللي هو space between the alveoli and capillaries. On histological examination, the inflammatory reaction is confined within the wall of alveoli. يعني هنا مو عندنا هاي alveoli وهنا wall of alveoli، دائما inflammation and inflammatory cell تكون within the wall. The septa are widened and edematous. They usually contain mononuclear inflammatory infiltrates. يعني السبتة separate between alveoli تحتوي على inflammatory cell mostly mononuclear such as lymphocytes or plasma cells. Alveolar spaces in atypical pneumonia are free of cellular exudate. هاي المعلومة كلش مهمة اللي هي تميز لنا community acquired acute pneumonia عن atypical pneumonia. شوف هاي space of alveoli ما تحتوي exudate or inflammatory cell، تكون free of cellular exudate. Regarding the clinical features of atypical pneumonia, it's characterized by acute non-specific febrile illness characterized by fever, headache and malaise. مرات حتى يصير عندهم myalgia يعني muscle pain. It's also characterized by cough that produce minimal amount of sputum. This type of pneumonia syndrome mostly occur in children and young adults يعني young age group. It may cause respiratory distress in severe cases. Regarding the investigation، تشبه investigation عادية for pneumonia، همينة complete blood count and to demonstrate white BC count and white BC differential blood culture. بس هنا مرات نحتاج PCR لأن most common cause of atypical pneumonia هي المايكوبلازما. والمايكوبلازما الانفستيجيشن نقدر نسوي لها either mycoplasma antigen or PCR to detect the DNA of this bacteria. Regarding the case, a 10-year-old boy present with fever, malaise, headaches and muscle pain. Chest X-ray revealed bilateral lung infiltrates with no signs of consolidation. So we have a 10-year-old boy, relatively young age, complain of non-specific febrile illness characterized by headaches, myalgia and malaise. Chest X-ray revealed the presence of bilateral lung infiltrate as demonstrated in this picture with no sign of consolidation. This presentation is consistent with community-acquired atypical pneumonia because of the relatively young age, because of the sign and symptom and the finding on chest X-ray. What is the most common microorganism? The most common is the Mycoplasma pneumoniae. Other possible causative organisms include viruses such as adenovirus, influenza virus, respiratory syncytial virus. Other organisms include the chlamydia species, etc. What are the microscopical findings? The microscopical findings include the inflammation which is confined to the wall of alveoli, infiltration of mononuclear cell including plasma cell or lymphocytes, and the alveoli is free of inflammatory exudate. أهم نقطة بالميكروسكوبيكال feature إنه الالفيولاي free of inflammatory exudate يعني ما بيها inflammation or inflammatory cell، بس موجود وين بالinterstitium and the wall. Regarding the hospital acquired pneumonia or nosocomial pneumonia, It can be defined as pulmonary infection acquired in the course of hospital stay. يعني هذا التايب of pneumonia يصير عند البيشنت اللي موجودين بالمستشفى فترة طويلة. Common in hospitalized person with severe underlying disease. وذول البيشنت usually عندهم severe underlying disease, immunocompromised يعني مناعتهم ضعيفة, or on prolonged antibiotic use يعني يستخدمون antibiotic, لذلك يكونون معرضين للنيمونيا فترة بقائهم بالمستشفى. Regarding the causative microorganism of nosocomial infection, they can be divided into either gram-negative or gram-positive bacteria. Gram-negative such as Enterobacteriaceae, such as E. coli, Klebsiella, etc., or Pseudomonas species. Gram-positive organisms such as Staph aureus. طبعا clinical feature, pattern of inflammation and radiographic feature تشبه community acquired pneumonia and depend on the specific microorganism. Regarding this case, we have a 70-year-old man had undergone hip replacements and stayed in the hospital for 15 days. Before departure, he suddenly complained of fever, cough, purulent sputum, and puritic chest pain. Chest X-ray revealed right lower lobe consolidation. What is the most likely diagnosis? عندنا 70-year-old man undergone hip replacement يعني تبديل مفصل, وبقى بالمستشفى لمدة 15 يوم. قبل لا يغادر المستشفى صار عنده fever, cough with sputum and pain on aspiration. سووا له chest X-ray that revealed the presence of right lower lobe consolidation, يعني عنده consolidation وين بالرايت lower lobe. What is the most likely diagnosis? من الهيستوري أول شي هو young قصدي old age, وموستلي يعني old age يكونوا immunely compromised. بقى بالمستشفى لمدة 15 يوم, لذلك هو معرض للنيزوكوميال infection بكل أنواعها. Develop fever, cough and purulent sputum, which are the signs and symptoms of pneumonia, which chest X-ray revealed the presence of lobar consolidation. So the most likely diagnosis is nosocomial pneumonia, يعني pneumonia that occur during hospital stay. What are the most common microorganisms? Could be, as we said, gram-negative such as Enterobacteriaceae, or gram-positive such as Staph aureus. List the possible complication. The patient may develop abscess, may develop empyema, lung fibrosis, or bacterial dissemination. Enumerate the stage of pulmonary infection. عددناها هن congestion, red and gray hepatization, وfinally resolution. Microscopic finding شرحناها بالمحاضرة السابقة. And thank you for your listening.